Hi guys, hello family, hello friends. This is Dr. T and welcome to Clinical Medicine with Dr. T. So guys, today I decided to give anesthesia a break. So we're gonna be talking about neonatal infections. I know many people do not like peds or neonates, and it's understood. But anyway, let us do neonatal infections, and I hope you're gonna enjoy it. Let's jump into it. So if you have not subscribed, please consider doing so. Neonatal infections. As we all know that a neonate is that small human being that is between a day and 28 days old, and neonatal infections are classified according to there are different classifications, right? But the one that we're gonna use here, which I find more helpful, is the timing, like the onset. So classification, so we're gonna use the time of onset here. Time of onset. So neonatal infections can either be early onset or late onset. Early onset or late onset. Late onset starts after 72 hours, so like 3 days. That's late onset. And then early onset is within 48 to 72 hours. Yes, it is just less than 72 hours. That's early onset. Late onset is the mode of transmission is usually, it's mostly horizontal. What is horizontal transmission? Horizontal transmission, okay, this side is going to be vertical. The most common, these are the most common. So horizontal, the child gets the infection from the environment. Meaning where the child is after delivery. It can be in NICU, it can be in the ward. So basically this is nosocomial. It's nosocomial. So but the child can also get the infection if the child was delivered immediately. Let's say it was an NVD, uncomplicated and whatever. Maybe day 2 they went home. It could be even from the community. And this becomes very important because the pathogens that causes in hospital or nosocomial infection, they tend to be different from those that cause community acquired, and because of that the antibiotics, they also become different. It's an important thing to remember. So we said this is the most common this side, but it has been proven that even vertical does cause, but the most common is horizontal. I'm just going to explain what is this now, the way they explain it. So the way they explain it is that so during delivery the baby can get colonized. Remember, if you are colonized, you don't necessarily have an infection. So from that colonization, an infection can develop a couple of days later. So that's how they explain it. But the most common one is the horizontal. So this is usually so the baby usually gets infected in the environment. Yeah. So vertical is the mother actually transferring the infection from her to the baby, and that can happen in utero. While the baby is still inside, just a couple of days while the baby is inside. And also it can happen from the tract, from the genitourinary tract, right? So especially if the mom is colonized with group B strep, which is the most common organism this side, group B streptococcus. So when I say in utero, it could be that maybe the mother gets a prom, and then develops chorioamnionitis, and then that quickly gets to the amniotic fluid, and then, like I said, or the infection can just make its way up from the GUT. Okay, so that's vertical, and this is the more, so it said that there's a high mortality with this one. I'm not sure why, but there's a high mortality. Now, what are the risk factors for developing these infections? So the risk factor for developing infections on this side prematurity, then prom, then prolonged hospital stay, right? Prolonged hospital stay, abdominal surgery, NEC, and also TPN, total parenteral nutrition. Then coming on this side, traumatic delivery, I mentioned chorioamnionitis, neonates, and low socioeconomic status. You know, low socioeconomic status plays a role in most infections because overcrowding, poor hygiene, lack of the necessary, like lack of water, like the basic necessities of life. You know, so most infections, they thrive in low socioeconomic land places. Meconium stained liqua. Meconium stained. That's why when there's a meconium stained liqua, that baby is always started on antibiotics even before they can present. Maternal UTI, so these are the risk factors. You know, upper catheters, IV lines, especially if the sterile techniques were not followed, right? So now let's talk about the common pathogens, or the pathogens that cause early onset and late onset, and the choice of antibiotics is related to the pathogen involved. Just use this one. Pathogens involved. So just get a chair. So the pathogen, the most common pathogen for early onset is group B streptococcus. Remember, this is just a group. The main organism there is Streptococcus agalactiae. I'm not sure if I'm pronouncing it right. So it's please just look it up, so and then you decide how you're gonna pronounce it. But it's Streptococcus agalactiae. That's the main pathogen there, and the reason for that is because this bacteria is said to be very common colonizer of the vagina and the GUD tract of a pregnant woman, such that in many European countries, women are actually tested for group B streptococcus just before they deliver, a couple of weeks before they deliver. It's very common, group B streptococcus, so they are tested. And another one is E. coli. I don't know who's gonna donate markers for me, guys. So the other one is E. coli. Why would E. coli be very common as a cause of infection? Remember, we said one of the risk factors is maternal UTI, and E. coli is the most common cause of UTI in females, right? And I hope you guys, you know how to treat, because remember, E. coli is a normal, forms part of the normal flora of the GIT, and the GIT and the vagina, they are very close. They're very close to each other. They're neighbors. So it's easy for the E. coli to move from the anal area and go towards the vagina. So, and I hope you guys, you know how to treat UTI in pregnancy. So you don't use ciprofloxacin as you would if you were treating someone who's not pregnant. So you use amoxicillin or augmentin or nitrofurantoin. There's another drug that I'm just forgetting, but those are the ones that you can use. UTI is very common, especially in pregnancy. It's common in females generally, but it's even worse in pregnancy. And untreated UTI can actually cause, as we can see, early neonatal sepsis. Another drug, another bacteria is Listeria monocytogen. Listeria monocytogenes. Remember, we had a Listeria outbreak in 2017. Apparently, there's a company that processes, I cannot remember the name of the company now. So it processes meat and form different products, including polony and all of that. So a lot of people, especially neonates, they died and got complications because the processed meats that the pregnant women ate when they're pregnant had were infected with Listeria monocytogenes. So yeah, and then we also have, there are other bacteria, but we also have Staphylococcus. Now let's go to the other side. To the other side, you still find E. coli there as well. You also find Enterococcus. You also find Staphylococcus, Staph, Epi, so Staph epidermidis, and then you also find, Klebsiella, Pseudomonas. These are usually nosocomial infections, especially Klebsiella, Pseudomonas, and then Proteus. But we are going to talk about these again when we look at specific infections, just a general overview. You can even have fungi there, yeast this side, right? So let's meet in part 2 of this video. We'll do the rest of the stuff. Thank you for watching.